Some people scream, some people use bad words. You're a laugher, so.
Yeah, I just gotta laugh through the
You'll laugh through the pain. Tell me a little bit about what's going on, when it started, all those kinds of things.
Yeah, so I was in a car accident probably about 5 years ago, kind of a rear-ended situation, so definitely had a lot of whiplash. I had seen a chiropractor for probably about 2 months, and you know, my neck and back pain had improved, but I've definitely lately noticed just a lot of tension in my upper shoulders, neck, trap area, and I do a lot of weight training, and I love to do bar squats and things like that, but I've kind of just avoided those because I feel like it's putting a lot of pressure on that area. And anytime I kind of turn my neck side to side, I definitely feel like a lot of like popping, discomfort, not really a lot of pain, but
so it's not painful when it pops, you just kind of feel like there's something in there that's not wanting to move with you when you do it.
Exactly, yes.
That makes sense. Anything else going on with the squats, or is it mostly just neck pain, no back pain?
Mostly neck pain. My lower back has been pretty good. I've been doing a lot of deadlifts, so it's kind of been strengthening like my lower back area. Just definitely a lot of concern with the upper.
So when you talk about the popping and stuff that you notice, is it up here or more down here?
Up there.
More up here?
Yeah. Yep.
And that's where it kind of hurts slash pops.
Slash also, I feel like I'm kind of looking at like an up angle almost. Like
it's very crunched together, that's for sure.
Yeah. I hear and feel the crunch.
I feel the crunch too.
Yeah.
Medical term.
Oh, yeah, that area is not so great.
Yeah, I feel a little swelling in here as well. Not a cause for alarm or anything, but yeah. So
you know exactly what's happening.
This one's supposed to glide. This one does a little bit, but not as much. Okay. All right. And the trap.
Also worked them out yesterday, so they're a little sore.
Okay, let's go ahead. Most of your neck musculature does not feel tight to me. I mean, I'm not saying that it's not, but that's a good thing. So it's more so spine related. Okay, we'll go ahead and go through these though. Have you ever had active release technique done on you before?
Nope.
Okay. Well, it's a soft tissue therapy, kind of made to make muscles move the way they're supposed to, but by actively releasing them. Pin. It's not very enjoyable sometimes.
Yeah, I definitely feel like the ticklishness.
Yeah, it's kind of like a weave. It's not a pin and stretch, but you're holding the muscle down, putting tension in the way that you want it, the muscle fibers to be able to move, I guess, in a healthy way. Probably not explaining that very well, but
kind of like back on track, basically.
Yeah, kind of trying to realign and reprogram the muscle to realize which way it's supposed to move. So see, yours doesn't want to move
no
in this direction at all. So we're gonna kind of slowly tension the other way, and then move the head through the range of motion. Is that not fun?
Yeah. It's feeling a little more relaxed though, so that's good.
It's funny, it works to an extent immediately, but over the next 2 to 3 days, it kind of will continue to work or continue to feel better. which a lot of people will notice. Like the first day they're in here, they're like, well, kind of helped. And then after they come in after a week, it's like, I feel great. So it's kind of cool how that works.
Yeah. You're definitely.
All the trigger points in these muscles referral patterns, which are kind of like just a referred pain when they're tight or irritated, mimic like headaches that come around here, anything like that. Is that how yours are?
Kind of like a tension headache.
Yeah,
for
exactly.
sure. Definitely more towards like the end of the day too, so that makes sense. Like strain from the day kind of thing.
Try to relax. You also have very tight SCMs in the front of your neck. So sternocleidomastoid muscles, they are these big guys right here, this chunky piece.
The one that kind of like.
Yeah. They attach right up here and go right down to your sternum. But yours are extremely unhappy.
Honestly, how do we cheer them up?
A little bit more. I'll give you a stretch for that too. Start taking notes because we got a lot. Alright, tuck your chin for me.
Yeah, that's a good one.
I haven't even released SCM yet, so that's gonna be fun.
No.
Might need to do that too. So it'll stop trying to overpower me in here. A lot of times when it's tight and it kind of feels like the patient won't let you hold their head.
Yeah, that's the thing.
And
My problem.
it's
Even when I'm trying, it's still
Yeah,
just
it's like you
fighting
can't help it. There's literally nothing that you can do.
That makes you feel better.
Yeah, no,
Yeah,
that's kind of like a cue that like they can't if you have to tell them a couple times.
I heard a pop. That was good.
Yes, that's good pop. That means
Yeah.
things are moving that weren't able to move.
It wasn't like the pop from before.
Yeah. And a lot of it could be that because all these muscles attach to places that are right around or on the place that you're saying keeps popping.
That makes sense.
And it could be that these these muscles are so tight that they're pulling it out of where it wants to be. And not that the pops are a bad thing, but it's kind of like a sign that it keeps moving around.
Yeah.
Alright, so we're gonna do some adjusting. Alright, so now with your eyes, I want you to look up and to the right. Take a big deep breath in. And all the way out. Relax. Position in the front of your legs on this. I think you might have extremely tight quads.
You know, that's probably accurate.
Yeah. Calves are okay, so we're gonna do this since we saw our.
Oh man.
Yeah, that's really rough.
Yeah, that's pretty bad.
So this was making your squat.
Ooh.
This is the part of it not being enjoyable sometimes. Promise it helps. Work through the pain.
Yeah, no pain, no gain.
This was part of the reason your squat went down a lot further when we put your heels on that.
So what'd you say was going on with that area? So the ankle mobility.
Ankle mobility, a lot of times, yeah, when your calves are super tight, they'll just restrict your ankle from the back. So we're gonna check out the front once we turn you around. But clearly we have some things happening here. Yeah. Clearly we got a couple things going on.
That was the ankle I was saying. It's been like very messed up my whole life anyway, so that's probably just thrown everything off like for a long time. But
everybody has one of those ankles, I think.
It was better for a few years, and
and then I decided to run cross country and screwed it up, so yeah. Too many ankle rolls.
That'll do it.
I do not run anymore, so that's good at least.
Yeah.
This side isn't as bad as the other one. I mean, I still feel it a lot, but the other one was like excruciating.
And it's mostly the outsides of your calves that are the worst part.
Mhm.
So we'll do some of those when you're flipped over. I'm gonna have you flip on your back now. Yeah.
Super tight. I always
A lot
get
of
pain right in there in my feet.
And a lot of it, if you notice, whenever I push your feet up, your knees come in.
Mhm. I'm a little bow-legged. I don't know if that's related.
If it's been like that your whole life, then that's fine.
Yeah. My parents used to make fun of me for being bow-legged all the
Then,
time. It wasn't like I needed like a brace or something like that. But
Yeah.
I'm a little naturally pigeon-toed, I guess.
So the arch support will help with that a lot. So especially with during your movements and whatnot.
Yeah. You think I should maybe just be using them in like my workout shoes, I guess?
Yeah.
The thing with squats though is I'll usually squat barefoot. Do you think I should?
Sorry. Had to do it. There we go.
That was a good one. I just wasn't expecting it.
The toes
I
are always the
should,
fun surprise. Yeah.